Hello, I'm Ramsey Main GDS. Topic today is PRP, PRF. What are these things? PRP and PRF and all these different initials you may hear for bone grafting and dental implants have got to do with blood products that can be made from your very own blood to be used to enhance the ability of your implant bone graft procedure to heal. Your own blood is rich and full of really good healing molecular enhancers that make your body heal faster. Of course, those happen naturally, but sometimes we have to concentrate them, and if we can get those chemical mediators and growth factors to the area where you had the implant or bone graft done, it can greatly help you to heal faster and without complications, reduce infections, and really reduce pain afterwards. Blood is drawn in your arm where we start your IV and take back about 2 to 4 test tubes of blood, about this size, usually between 2 and 4 of them. And inside these test tubes, your blood is drawn. It's mixed into a centrifuge machine, which is a machine that spins and will separate the layers of your blood. When blood is separated, there are areas that have very thick, rich areas of platelets and growth factors. Those can be extracted from these test tubes and then reintegrated or mixed into your bone graft material, whether that be cow bone or your own bone or bone from a tissue donor, the 3 or 2 of them mixed together. It will help enhance your bone graft healing. Sometimes the implants are actually dipped inside of that also too. That will help. I call it like turbocharge your healing. It just makes things heal faster. At the very top of the test tube, there's a kind of a yellowish layer that's called platelet-poor plasma that can also be used for enhancing the ability of the gum tissue to heal faster. In the red test tube, we can develop what we call platelet-rich fibrin. Platelet-rich fibrin is pretty neat because it's a really tough, durable, kind of gooey, slimy, stretchable, almost membrane-like material we can make from your own blood. Fibrin is what helps your blood to clot and help kind of hold things together. I use it to help enhance the ability of the bone graft to hold together. Bone graft materials are often made in small particles, and the platelet-rich fibrin can help hold those graft particles together from migrating away. But most importantly, PRF, PRP, they harness what we call bone morphogenic protein, BMP, BMP2, and what's called platelet-derived growth factor, which is PDGF. Those are naturally occurring in your own blood. You do not have to go and buy separate products in order to get this. You just need to concentrate it from your own blood. These are techniques that are unfortunately not used by many dentists or surgeons. I have been using this technique for probably around 10 to 12 years. It's very helpful. It's one of the things that allowed me to do really major procedures, whether we're placing one implant in a small bone graft or bilateral sinus bone grafts and onlay block bone grafts and full mouth, maybe 12 to 15 implants at a time. I find that when I use these blood products that are made from your own blood, not somebody else's, that your healing is faster, better, and you have reduced healing time. And best thing of all, it's safe and doesn't cost you anything. It comes from your own blood. I really am a huge believer in it. When used properly, it really helps quite a bit. My name is Ramsey Main GDS. The blog is burbankdentalimplants.com/blog. Thank you very much for listening. I'll see you next time.